Hello, my name's Claire from Conscious Chemo, and here I am in one of the most, I would imagine, beautiful settings in the UK, on overlooking Buttermere Lake up in Cumbria in the Lake District. I mean, gorgeous, never been here before. Anyway, I'm reflecting and sharing some of my top tips based on my experience over the last year navigating chemotherapy and stage 3 breast cancer. And I'm going to share the most common side effects I experienced and how I navigated them naturally. So I wanted to have minimum medical intervention for my side effects, and I did. I didn't have hardly any. I had a couple of steroids after my first round, and then I didn't have any after that. So tiredness, I rested. That was nice. I meditated a lot, did lots of yoga nidras, and actually I tried to rest before I felt really tired, although sometimes I really did just need to rest. But I rested when I didn't feel I needed to in the day sometimes too, and I think that really helped to feel really tired. I got diarrhoea between my first and second round. I had natural yogurt and rice. I'd learnt that from a tip when I was ill in India. It works every time. It worked absolutely this time. As soon as I had it, I didn't have the runs again, and then things started to form. I did come off juices as well. So I've said in my other video that I juiced, but I didn't juice all the way through my high dose chemo. I came off after I had it. I had my liquid fast for the 3 days, and then I actually gave myself a little bit of a break of the juicing. Because it just didn't feel right for me at that time, and it didn't feel like my stomach wanted that. I think I wanted more substance. So I listened to my body intuitively and made amends to what I was eating during my high dose chemo. I had sourdough bread, which my sister-in-law very kindly made. I've actually researched places now you can buy that are homemade. Obviously wholemeal, organic, sugar-free, salt-free. That was really great. So anyway, natural yogurt or kefir would be even better. Kefir's got more natural good bacteria in it, and you can also, if you know anybody that feeds their own kefir to make it at home, that would be fantastic. You can get kefir water, kefir milk, and kefir yogurt. I've really enjoyed the kefir yogurt. That also helped with another side effect of mine. So I got a really horrible taste in my mouth, which is very common, I think. It actually got better with each round, and I think that's because I was looking after my digestive system more. So but for the taste in my mouth, I would just rest, have some kefir and just rest it in my mouth, and that made it feel really nice. But I didn't eat sugary suck sweets, which I can imagine would have taken the taste away, but I didn't want to have the sugar. So I found alternatives. The thing you could do is just suck on a bit of licorice. Somebody recommended sucking on pineapple, but I also had side effects. I also had mouth ulcers, so I really didn't want to be sucking on pineapple with mouth ulcers. So mouth ulcers I also got between my first and second round. Again, I didn't get them again since. I went into a meditation because I did feel myself coming off. In fact, that was another one of my low points that I forgot. And I meditated and said, can I be with this right now? And the answer was yes, I could. Never got them again, but I did start adding aloe vera juice to my daily regime. So I would have 2 tablespoons of aloe vera juice as soon as I woke up. What else was I having? And then I still had my green powders. I was having Essiac tea. So I was doing a lot to really try and look after my digestive tract, which is the reason you get mouth ulcers. Everything's coming from the gut. So the more you can do, put good bacteria in your gut, lots of filtered water, aloe vera juice. You can also take Traumeel, Traumeel, which is meant to help the inflammation of the gut lining, which my naturopath recommended. So there are tips there, but anything you can do to look after your gut health is going to help massively with your side effect management. So I also I was using mouthwash, On Guard mouthwash, when I first started the treatment, and then that became too harsh. So I would put coconut oil in my mouth and just give my mouth a rinse with coconut oil. I brought a electric toothbrush, which felt really good. So I had a manual one before, but when I used the electric one, it was really much easier to clean my teeth, and it kept my mouth feeling really fresh. That also helped to take the taste away. I was using a chemical-free toothpaste, so I was using On Guard, but there's loads out there. So I definitely recommend a chemical-free toothpaste. And if you haven't got an electric toothbrush, I would recommend using a electric toothbrush. Somebody gifted me some really great vegan face moisturiser, and also lip balm and hand cream and nail cream. I think that my skin went really dry, my hands especially, later on more, but that was really nice to have to hand. If you're not into going into the sea, I think the cold water was really good for counteracting the heating aspect of the treatment. After my first round, I got a red rash on my face. I looked up face rashes with chemotherapy, and it said that would stay there for the rest of my treatment, and it could stay there for life. So my ego immediately was like, that's not great. And then I pulled it back. Claire, let's wait and see what happens. Went in the sea for a few days. The rash went and it never came back. So just to say, don't read anybody that's telling you categorically this is going to happen or this isn't going to happen. Wait and see. Another example of that was my ear. I felt like I had a blocked ear for a long time actually during my chemo, and I called the doctors because at the beginning I was worried about having an infection, because they say if you have an infection you've got to go straight in. And again, I looked it up and it said that chemo can make you deaf, and listed the types of chemo, and my type was in there. So straight away, of course, you can run away getting worried that you're going to be deaf. And of course, it was just, I was a bit run down. I probably had a little bit of a virus actually, looking back in between those first two rounds. And that blocked ear was there on and off for quite a long time during my chemo, as I've had a runny nose pretty much throughout. I would have blood when I blew my nose for a long time. That's just because the blood vessels are being affected. So all the way through your digestive tract is going to be affected, and that there's no getting away from that. So, in terms of navigating those, it was just a case of accepting them, understanding why it was happening, blowing my nose, being gentle, and not worrying. And I still get a drippy nose. That's one thing I notice now after my chemo. That nose is still dripping. So that was one of my side effects, but it wasn't bothering, but it was there. In terms of the cold, if you are finding you've got a rash on your face, you could try a cold shower just for 2 minutes, which is meant to really be so beneficial for our immune systems and health. But if you're not going into cold water, a 2-minute cold shower, and that would be really cooling. I would recommend trying it because you've got nothing to lose. Having a cold shower, and you can slowly work your way up to how cold you have it. What else? I got boils around my groin area. One was absolutely huge. I did call about that, and luckily I avoided having antibiotics. I really didn't want to have them. Warm baths, putting just a warm covering over it. I did use tea tree oil mixed with coconut oil, a few other essential oils just to draw it out, and then waited and let it do its own thing, which it did. I was, quite conscientious about how it was going to look afterwards. It didn't look that sightly, but luckily the body's amazing. It does heal. It has passed, and there's a very mild mark there now, but you can't really see it. And I had another one that came up that wasn't as big, and because of the first one resolving, I then trusted the second one would resolve, and again, it passed. Again, I applied the warm baths, the warm coverings, and a tea tree essential oil. I think I'll use another essential oil as well. So, keep an eye on these things, but I didn't want to have antibiotics unless I absolutely needed to, because antibiotics get broken down in the gut, which is also going to affect your digestive system, which is going to increase the significance of side effects. So I had a bloated belly that came up between my third and fourth round. it's not as bad, but it still hasn't completely resolved. So I am actually going to have a few tests for that. I feel like something's been bearing down. It's been affecting my bladder and it's been affecting my pelvic floor. So again, not great symptoms, but I haven't let it affect my well-being. It has been quite distracting. On one occasion, I counted 17 trips, 17 urinations in 24 hours. It's not like that now, but I still feel there's something not right going on, and that could well be to do with the fact that my menopause has been triggered or seemingly triggered from the treatment. I'm on hormone therapy. I was probably premenopausal coming into this, so it's probably more hormonal side effects, menopausal side effects, I'm thinking now. I did do water fast. I did a melon fast. I literally have melons for 5 days and water. I tried for 10 days. I just had vegetables and water. And the bloating did go down, but then as soon as I started eating, it came back again. So in the end, I decided to just let it be and let nature take its course. I am still on low dose treatment, so that could still be irritating it a little bit, but I am getting just a few checks to just rule out anything untoward, and just to check that there isn't anything above happening. So, but I haven't taken any medication. Constipation, I haven't needed medication for that. So drinking lots of water. I have been having vitamin C, a teaspoon of powdered vitamin C in water with a bit of lemon juice, which helps if you do have constipation. I stopped taking any supplements the day before, the day of, and the day after my treatment, just because of interactions. There's lots of alternative books saying there aren't any interactions. Chemo's so strong it's going to have its effect no matter what. However, for my peace of mind, I decided to come off them for like a 5-day window and then go back on the ones I felt like going back on. But I did have sporadic vitamin C, even though it's not recognised by a lot of oncologists as being a beneficial thing. That wasn't my understanding, and so, but I didn't go all out on it. I had some, and I think that helped. And obviously, just eating a diet with lots of fibre and lots of veg is going to help elimination. So I would recommend doing everything you can to keep your elimination regular, because especially the experience I've had with being regular is that my digestive tract's been affected. It's bloated belly and a bit of bearing down, which hasn't been ideal, and constipation would make that worse. So I'm really pleased I haven't had that. So there are my main side effects, I would say, and how I have navigated those. No others are coming to mind at hand. So I really have kept a pretty normal life, I'd say. But for the high dose rounds, I have really. I gave myself permission to rest and heal, and I think that made a huge difference. If I'd kept trying to carry on as normal, it would have been much harder. My body would have, and I'd have had more meltdowns, I think, as well. So I think giving myself the rest and the healing time helped me to be more emotionally balanced throughout, and also because I was tuning into myself so often, that helped you to drop the fear. So I hope this has been helpful for other people. Oh, the other thing I did do was I had a colonic cardiotherapy treatment the morning after every round of high dose chemo, and I know the first 2 or 3 were very powerful, indeed. So it depends if it's your thing. Do your own research. My best friend happened to be a colonic cardiotherapist. Completely trusted him. I was still a bit apprehensive because you have been reading the do's and the don'ts, but I'm really glad I did, and it did help me. So I can share that. So they're the main ways. I would say the most important thing is what you're putting into your system whilst you're on chemotherapy does make a huge, colossal difference. So if you're only going to do one thing, I really would look at making some dietary changes to support you. Drinking more water, making sure you've got fibre going through, and having lots of turmeric and ginger that will help me for sure with anti-sickness. And if you do get diarrhoea, natural yogurt or kefir yogurt with plain rice, You can have wholemeal rice ideally, but if not, basmati rice. I actually really like the taste of that too. Just worked straight away. So I hope you find those tips helpful. Good luck on your healing journeys. I'm sending you lots of well wishes, positive vibes, healing vibes, loving energy. We're all in this together. And my last little tip is, when you do get these side effects, just keep coming back to the mantra that this too will pass. I know from experience it can trigger, worry. It can be off-putting. It can make you feel a bit down. But if you come back to that place of centre and remember this too will pass, it's a really powerful little 4 words I found, and I'm having to practice that right now. So it's an ongoing journey, but I still feel like I'm living to the full. I'm having new experiences. I'm having amazing experiences whilst I'm doing it, and that is so liberating and so powerful. So if we can find that state of joy when we're going through something like this, then things can only be good all the time. Lots of love. Bye.